thank elect and the Ministry of Rajasthan government for giving opportunity to come here and organize this session. Before I start the panel session, first I think from the NABH, I would definitely like to, in the form of best practices, I would like to give an overview of the role of NABH and what new initiatives we have taken for bringing a transformation in the country. In spite, this morning we have been hearing a lot about product innovation and economic growth. Same way in India, healthcare, in spite of the Indian healthcare industry seeming to growing at a rapid pace, quality remains still a serious concern. Total healthcare expenditure in India is 3.9% of GDP, and private share of expenditure is 15.8%, government share is 26.2%. Affordability and accessibility is a very big challenge. Why we talk about quality and patient safety? We know that in an advanced country, even Canada, 1 in every 10 adults contract infections in a hospital, and 1 in 10 patients receive wrong medications or wrong dose, and more deaths due to hospital harm. If you see, the more than all the deaths due to roadside accidents, the breast cancer, motor vehicle accidents, and HIV combined together, the deaths due to hospitalization harms are to the tune of almost 98,000 to 1 lakh per annum in most advanced countries. And even we see healthcare industry, probably the risk of dying in a healthcare environment is 1 in 300, while an air crash is 1 in 10 million. In that way, that health industry is probably most of the dangerous industry. And this is a few examples. The simple things which clearly reflect lack of system and careless approach. So there is a need for quality. Patient safety is a global concern, not only in India, it is all over the world. Most of the countries have established systems for quality systems, or some are in process to ensure safe care. India is also committed for quality care, universal care, and affordable quality care. And when we talk about quality is change in culture, it basically calls for change in the mindset, behavior, and attitude. And various national and international forums are working on patient safety goals. Most of the common identified goals are patient identification, improve communication and handoff medication safety, prevent infections, identify patient risk, prevent wrong site, wrong patient, wrong procedure, and false prevention and patient satisfaction. And why these harms we are talking about occurs due to system failure. It is not an individual fault. It's a system, some problem in the system that leads to this high degree of harm to the patient. And how we can improve? Standardize. There is need for safe design by standardization, by protocols, the checklist, learn when things go wrong, and these are all examples of best practices we are talking about. They all lead to system improvement. An accreditation system in a hospital, it stimulates a safety culture, effective communication, medication safety, ensure that safe use of the high-risk medications, and provide a framework for physical environment that supports the safe delivery of the care, infection control practices, and risk assessment. The best practices facilitate compliance to the standards of accreditation system, quality and safe care at low cost, and best practices for excellence. Then we talk about accreditation standards, that is minimum compliance to standard, but about beyond accreditation. These are the various quality tools, the best practices, which will suggest the status and further excellence of quality, because when we say quality is a journey, accreditation is not the end of the journey, rather I will say it is the beginning of the quality journey. And it is always quality, that we say quality is a continuous improvement. So best practices give us the way for excellence. So for all this NABH in our country, the National Accreditation Board for Hospitals and Healthcare Providers is a constituent board of Quality Council of India, which is autonomous body under the Ministry of Commerce and Industry, established in 2005. And first hospital accreditation program 2006. In our country, NABH accreditation is a voluntary participation, and the role of NABH, I will just skip most of the slides because time is too short. And our NABH is the international definition. NABH is recognized and accredited by ISCOA. Hospital standards are recognized and accredited by ISCOA. ISCOA is the international organization which accredits the Canadian, JCI and other international standards. Same way NABH standard and NABH organization is recognized by ISCOA. And most of the standards, we have 10 chapters in the hospital standard. The 5, the marked in green, are patient-centered standards, and rest 5 are standards are organization-based standards. And what does NABH mean? I will just skip. Everybody knows accreditation is basically brings about the maximum benefit goes to the patient as well as the organization and community also. And various programs being run by the NABH are accreditation of the hospitals, the main program of the blood bank, small healthcare organizations, the nursing homes, university centers, PHCs and CHCs also we have separate standards, and accreditation of Ayush also we have Ayush clinics as well as Ayush hospitals accreditation standards, wellness centers and medical imaging standards, accreditation of dental standards and allopathy. Allopathy clinics also we have a standard for that. A new program we are going to start now, first time in the world, is accreditation system for clinical trials. For under this program, whenever there is a new trial is proposed, accreditation of the investigator, the ethics committee and the clinical trial site shall be done. Most likely going to start in a month or two. If you see the trend, 2006 over that, you can see the last 2 or 3 years, the increased awareness and more hospitals is going for accreditation. If you see the overall status of various certificate programs and accreditation programs in the country, we have 563 healthcare facilities certified by NABH. And if you see the map, also for every state, we have applications and accreditations. But definitely you can see there is a concentration of red dot in few areas, more in South, Delhi, Gujarat and Maharashtra. And we have definitely when we talk about quality, by saying quality is variable. In the hospital program, we have 64 quality indicators every accredited hospital has to capture and maintain. Out of 64, 11 standards are mandatory to be reported every quarterly to NABH so that properly analysis, interpretation and feedback can be given to the accredited hospital. If now, since 2006, only we have received certifications of 560 institutions. Should we continue the same number, the same rate, or something we should do to become more and more inclusive so that all healthcare and most of the hospitals they start the quality journey in our country. It is estimated that there are 80,000 healthcare facilities which are providing healthcare delivery to the masses. So what we have come now, we have done, we have now approached, step-wise approach we have adopted. It means any hospital they can apply at entry level, at progressive level or the full accreditation existing level. Besides this, 3 more programs we have started, Stay 5. Stay 5 is nothing but infection control program. Our chapter 5 of the hospital standard is used with Stay 5, nursing excellence. If the nursing excellence, nursing care of the hospital can be improved across the hospital, 80% work is done. Then improvement in laboratory, lab tests. So these 3 more programs we have started as a sensitization program and step-wise approach to start this quality journey. So entry level standards were started in 2014 and they are very easy, and you will see they only compared to the full accreditation standard. Again, the hospital accreditation standard they which has 636 objective elements, but the entry level hospital standard pre-accreditation is only 167 objective elements, and all these standards are easily achievable. Remember that bad systems and not bad people are responsible for most of the errors. Do remember that you have to change the system and propagate the safety culture, the patient safety. This most important important. It's the public in expectation that they want from us a care with compassion. This exists in our country and must continue to exist. And remember to take the lead and make the healthcare safe. This was all about an overview of energy activities what we are doing. And whatever standards say, most of the things the patient safety goals, they can be achieved by standardization practices what hospitals are doing. Now I will come to the main session. I will invite to share his views about